Hi guys, another one of those videos that I thought I would just do like rather out of the blue without giving any warning or anything. So over the past few weeks, I've been getting so many requests that I should do a video on what it's like surviving in final year and how to make it during final year. And I think I'm going to do a two-part video. Actually, I'm going to divide this video into two parts. How to make it through your internship, how to make it through your final year of medical school. Because I think this is something that is rather not so much talked about on the ward, and even looking at the exposure that you get before you actually decide to go for your final year. No one really says so much to you guys and preparing you for how it's going to be. It started raining, so I'm literally recording this coming off from a cold day. So if you hear noise and if my train of thought is not entirely okay, just know that I'm tired. So yeah, so as you already know, seventh year comes with a lot of responsibilities. There's so many people that don't know what they need to know. They don't know how to go about it. It feels overwhelming. It feels like you're taking on so much responsibility. It feels like as if you're drowning. It feels like as if there's so much that you have to do in a short space of time that you end up not knowing exactly what to do. So remember that seventh year it's not specialization. It's sort of you getting into the realm of being able to take care of patients, being able to manage patients, being able to keep them alive, basically. You're going to be rotating in the same departments as you did back when you were in fifth year medical school. So that's what's going to be a bit different when it comes to seventh year. The only difference is that you're going to be going a bit more in depth. You're going to be looking at management of certain conditions. You're going to be looking at how to take care of certain conditions. Maybe it could be certain complications that have arisen because of the condition itself, sometimes even because of the management that you're instituting. Those are the things that you're going to be looking at when you are pretty much in seventh year. Now, off the bat, I must say, if your fifth year experience was very good and you did what you were supposed to do and you went the extra mile, seventh year would be more of a breeze for you, or a better experience for you. The same goes if you didn't do much at fifth year and you're now getting into seventh year, and then once you get into seventh year you realize that seventh year is now a bit more bulky for you, then you may not do so well. But that doesn't mean it's a rule that is actually set in stone. You may not have done so well at fifth year, then at seventh year you do much better. You may have done well at fifth year, then at seventh year you struggle. So regardless of whatever you have done prior at your fifth year, whatever you have done in the previous years, what really matters now is what you're going to do in this particular year. Because there's a lot of things that you need to know as a seventh year that prepare you to become a safe intern, a safe junior resident medical officer. So first things first is putting your material together. Many people ask me, what am I supposed to read at seventh year? What's so different from seventh year to fifth year? And I always tell them, it's literally the same books that you've been reading. If you've been reading through Kumain Clark, it's the same Kumain Clark. It's not like we're reading secret books somewhere on secret things. It's the same material. So if it's Kumain Clark, it's going to be Kumain Clark. If you're reading through Davidson, read through Davidson. If you're reading through Harrison, read through Harrison. But of course, with those much bigger books, you must know how to read them as a seventh year, because they have a lot of data in them that may not be necessary for you at this particular stage, especially if you're not specializing in that particular course. So have a list of important textbooks. There are some important textbooks that are there for each and every course out there. I think I have an article that I wrote on excelling in seventh year. I think I should have added the textbooks to that. So if you're really interested in that, just drop a comment on this video. There are some textbooks that you should have as a seventh year, and go through those. But more importantly, remember you're preparing yourself to start seeing patients, have that responsibility with patients. So familiarize yourself with the guidelines. What do I mean by familiarizing yourself with the guidelines? There are what we call protocols that you should go through. There is a protocol for internal medicine, the drugs that we give to our patients. And if your hospital has a local protocol, that's even much better. Make sure to find the local protocol for your hospital. There's a protocol for obstetrics and gynecology. I think there's even one recent one that was released last year for pediatrics. If you don't have that, make it a habit of you having it. There are protocols for infectious things like HIV, infectious things like TB, things that are always constantly, even COVID, things that are constantly being updated each and every single year or regularly. So you should acquaint yourself with those protocols to begin with. So the most important thing for you to get as a seventh year is those protocols. Read them from cover to cover and know them from cover to cover. That's the first step. When you're preparing your material, make sure that you have your textbooks. I think a list of textbooks, I would disseminate that if those that really want. Number 2, have your protocols that are ready. And make sure that they're the latest protocol. If there's anything that is much more newer, read the newer stuff, so that, because there's some things that we're no longer giving now that maybe we used to give 10 years ago. So if you're reading something that's from 10 years ago, it may not be applicable now. It may make a bit of some sense, but it may not be applicable now. So read through those protocols. Then once you have read through the protocols, once you have read through the textbooks, the third important thing that you must do as a seventh year is practice as many questions as possible. Remember, they may not necessarily repeat the same questions in your exam, but definitely it will give you an idea of how the questioning is like. It'll give you an idea of what you should emphasize on when you're studying. It'll give you an idea of the important things that you must know and things that are tested on exams. Because if you're just reading blindly, you think everything is important in the textbook. And yeah, everything is important at a particular stage in your career development. What may be important at 7th year may not be so important at 5th year. For example, management wasn't so important in 5th year, but now it's become important. Interpretation of lab results, interpretation of investigations was not so important at 5th year. Now it's become important at 7th year. Same thing, the transition from, again, 7th year to internship. There are other details that you're going to miss out in 7th year that will make so much sense when you start looking at patients, when you start seeing patients as you'll now become a junior resident, as you've now become an intern. So make sure that you go through as many questions as possible, practice as many questions as possible, possibly with a friend, a study buddy, someone who you study with, and write some explanations. If it's MCQ, make sure that you get an explanation for that MCQ, why the answer is this and why it's not that. Don't memorize the answers. Because once you memorize the answers, if they bring you the same questions and they just twist just one word, you're gone. Because you think that it's the same question and the answer was C. Even if they just jumble the order of the options, because you memorize that this particular question, the answer was C, it means that you're going to get that wrong. So go through as many questions as possible. It'll give you an idea of what examiners actually really want of you. Then have a strategy. So have a list of topics that you're going to cover. Again, there's a list of high yield topics that I have for 7th year. There's a list of topics that I have for 5th year. If you're really interested in this material and the list, reach out to me. So this list of topics, it doesn't mean that once you have these topics, those are the only things that you must read. It's going to make you like a donkey, for lack of better terms. You know, like if you're like on a donkey, it has these things, blinders on the side, to make sure that the donkey is facing forward and it doesn't get distracted by everything that's on the side. So with that in vain, I don't want this list of topics to actually create you into a donkey. It's just to help you with where you should start with. The most important things to start with are your emergencies at 7th year, because those are the things that you're going to be dealing with when you're on call, and you should know how to manage those, because those are things that are potentially going to kill your patients. There are some benign conditions that may not necessarily kill your patients. For example, someone just comes in with maybe a common cold. It's not something that you'd expect them to die immediately from. But if someone comes in, for example, with DKA, someone comes in, for example, with a stroke, someone comes in, for example, with a hypertensive emergency, those are things that you want to be able to handle so that your patients are safe and so that your patients don't die. So make sure that the most important things you go through in 7th year are the emergencies. Then once you're done with the emergencies, then you can cover these other common conditions, these are the benign conditions that are there on the ward. Then you can now, if you have extra time, now start covering the rare conditions, because sometimes in your exams, they do bring you a few rare conditions here and there. Then as to how your study strategy should be, really, I've done so many videos on that and how you should approach that in 7th year, but I'll just give you an overview of how my plan was in 7th year. So first and foremost thing, you will never get a class where they teach you on dosages. So if you want to familiarize yourself with the dosages, every time you're studying through a topic and you come across a drug, there's something that's known as the BNF, the British National Formulary, which has a list of all the drugs. Make sure you get the latest edition. It has a list of all the drugs. Just go through there. It will give you, sometimes it does give you the mechanism of action. It will give you the dosage that is required, the formulation, how the drug is administered, important side effects, common side effects, and even rare side effects. It will also give you drug-to-drug interactions, and even sometimes the pricing in the UK, though the pricing may not be the same as what we have here locally. So make sure that you go through the BNF, because that's what's going to help you now. Familiarize yourself with the dosages. And for the common drugs that you see, especially if you see a drug at the hospital, you see a condition, you go through the drug chart, you see that drug, you note it down. You should have a book where you are noting down your drugs so that you can look them up. But this is not something that you'll be penalized for if you don't know. Of course, in emergencies, you must make sure that you know the doses by heart. But things like chronic conditions, where you can have time to actually think through your patients, then we don't want you to be guessing doses. If you're not so sure about the dose, check it up. But of course, the more you prescribe, the more it becomes a part of you. So make sure that you have a book for drugs and you list down all the drugs that you come across, and you make sure you go through the BNF, you check the dosage, you check how it's administered. If it's an infusion, how is the infusion prepared? How is the formulation mixed? How is it run? At how many mils per hour? You should know how to calculate all those things. And I think I've done videos on this on the channel. Then once you have now sorted that out of the hand, when you are now beginning your study process, remember, it's not just about you reading on investigations and management. Sometimes you get questions in the exam where they ask you about, let's say, for lack of better terms, pathophysiology. Yeah, maybe writing an obstetrics exam and they ask you about the pathophysiology of gestational diabetes. And if you've never read about it, or you last read about it in 5th year because you're focusing so much on looking at management in 7th year, then you're lost. Of course, even on the wards, when you come to the wards, we'll ask you questions on pathophysiology, especially as a 7th year. You're supposed to be able to know that. So you should be able to marry your basic sciences to what you're seeing in your patient, and you should be able to interpret it. That's your role as a 7th year. So even when you're studying, your main focus, of course, will be looking at investigations, being able to interpret your investigations, then your management plan. Then afterwards, after you have now learned that and committed that to memory, you should also revise on the basic things, the definitions, pathophysiologies, etiologies, and all those things, so that by the time the academic year is actually finished, you'll be almost good in all the things that you're passing through. So during my study routine, usually I would often, if I'm studying a topic that I did quite extensively at 5th year, I'll start off at the end. Like I'll start off by first looking at the investigations first, then looking at the management, whether pharmacological management or non-pharmacological management, whatever is there. Then afterwards, then I'll come to the beginning of the topic, because I know that those things at the beginning, if I spend so much brain power and time looking at those, if I'm reading through the management, I'll now be tired and I won't have time to finish that management. So I want my best foot to be put forward. So I want to go through the management first. But of course, this only works for the conditions that you have already understood at 5th year. And this bears so much on the past experiences and the past things that you have done at 5th year. So if, again, you haven't gone through those conditions, go through those conditions. Watch a video to help you understand the clinical features. Watch a video to help you understand the pathophysiology. I mean, we have a bunch of videos on this particular channel. So I don't know why you're suffering. So just watch one of my videos. I'm sure I go through a lot of the basics, and then I also teach you about the management on the channel. Again, if you haven't yet subscribed, what are you waiting for? At this particular moment, we have crossed 30,000 subscribers. So the big thank you for that. And we hope by the end of this year, perhaps maybe we can reach 60,000 subscribers and double the subscriber count. By maybe next year, we could reach 100,000 subscribers. Who knows? But make sure that you put your best foot forward, in essence. So once you do those things and you have a study buddy or a study group that has accountability and you're following your schedule, you become a very good seventh year. You have no problems. Of course, there are some additional resources that you could use. There are many different apps. Medscape is a very good resource. MSD, the Merck Professional Manuals, a very good resource. Yeah, you could be going through some articles, some journals, but I usually like to advise this for my junior residents but you can, if you have time in seventh year, you can actually start going through them, because remember, it's evidence-based medicine, and a lot of that evidence is based from research. So sometimes there are some things that are changing and guidelines are going to be a bit behind compared to the research that you're going to be having much later on. So yeah, so in essence, that's what I can advise you as a seventh year. Now, when you make now the transition from being a seventh year to now becoming a junior resident medical officer as an intern, again, it's a whole different ballgame. Internship is not like school. Yeah, with time, it begins to repeat. Cases begin to repeat and things become so familiar, and you get a few odd cases here and there. Sometimes you get a combination of cases here and there, but nothing much out of the ordinary. So if you're a good seventh year, it will translate to you how you're going to be working as a junior resident. So as a junior resident, your focus is to keep the patients alive. So generally, what you see on the ward, you go home and read. You go through the protocols. Those should be your best friend. Going through them, go through the conditions. Now, as a junior resident, this is now your time to now start consolidating that information, patching up the gaps that you had as a seventh year, patching up the gaps that you had as a fifth year. Use this time now to read through certain articles, because you don't have exams that you're looking forward to. Of course, there'll be grilling here and there from your registrars and the consultants, but use that time now to go through articles, to go through certain researches. If someone mentions a certain drug, if someone mentions a certain statistic, if someone mentions a certain study, now is the time for you to go through and read that study. Ask you a question on the what that you have no idea over. It means that's the topic that you must go home and read. Once you now have jot that down, you should go and read on that topic when you get home, because that's the only way that you're going to fortify your knowledge. The resources are largely the same. The protocols, make sure you know those front to cover. But of course, those things, protocols, in my opinion, sometimes stop you from thinking, because you're sort of like just, it's this way or no other way. So if you're given a case that's not really clear cut, or that's not really in the protocol, then you're thrown off. So, but make sure that you know the protocol, you're acquainted with the protocol. Research material is quite good. PubMed, go to PubMed, search your articles, read through certain studies, evidence-based medicine. The third thing is, of course, revising your information. You won't have much time to actually sit down and read extensively as an intern, because you'll be tired most of the time. So videos usually got me through when I was doing my junior residency. I used to watch a bunch of videos. So watch a lot of videos, and it will help you recap on the things that you have learned. Take down a few notes if you are taking down a few notes. Medscape is also a good resource. MSD is also a good resource. Ambos also, I hear, is a good resource that you can also actually have a look at. Take a few clinical cases. There's a good book that's known as 250 Cases, for example, and even the Oxford series of books are actually quite good, especially for those that are doing the junior residency. And just like with seventh year, emergencies first. Make sure that you know the emergencies first, because that's what is going to kill your patients. And if you're on call and you're called to resuscitate a patient, you have no idea what you're doing, you have no idea what you're dealing with, patient is going to die. So make sure that you have a good hook and a good hand on pretty much the emergencies first, then the cases that where you are, what they're dealing with, the type of cases you're seeing every day, be knowledgeable on those, then start reading around some of these important other things that may be related to your particular unit or wherever you are. So that's generally the advice that I can give you. I can't tell you that it's going to be easy, and I can't tell you that it's easy. Seventh year is never easy. Learning medicine is never easy. It's easier working, but if you're in the process of learning something, trust me, hear it from me, it's never easy. And will it be worth it? Yes, definitely it will be worth it. Your sacrifice will be worth it. And remember, what you do on your own, at your own time, and when no one is watching is what is going to count the most. What you're going to be doing with your friends, what you're going to be doing with your family or whatever may not even count so much. You may be doing something for show, that okay, I'm going to the library every day so that people can see that I'm studying. But then you go to the library and you sit and your mind is just drifting off. You're not doing anything. You're just lying to yourself. So what you do when you are alone, on your own, without anyone watching you, the effort that you're putting in, the sacrifice that you're putting in is going to show. And at the end of the day, it will depend on wherever you end up. I mean, at the end of the day, you have someone's life as your responsibility. So make sure that you make the most of it. And most importantly, the single one thing I always told myself during medicine is, if this was a relative of mine that I was seeing, if this was my mother, if this was my father, would I be happy with the care that I am giving this person? If my answer is no, then it means I need to introspect. I need to see where it's wrong. If it's that I don't have enough knowledge, I need to go home and read. I need to go home and fortify my knowledge. I need to consult. I need to ask my seniors. I need to learn. That's the only way that you actually get to grow in medicine. And that's all I had. Stay happy and stay healthy. Till the next video.